Hi, my name is Dr. Rana Javadaskar, and I'm a public health professional. Today, I thought we should talk about Ebola outbreak, which is happening in Africa and creating headlines all around the world. So, what is Ebola? How dangerous it could be, and does it has a potential to start a pandemic? That's are going to be our topic. I will touch briefly on all those points so we can finish this presentation quickly. So Ebola is a type of virus, so what we call viral hemorrhagic fever, um, first identified in 1976, but it's a very high fatality rate, around 50%, but in some cases it goes above 80% also. That means anyone who gets infected with Ebola is likely to die, like 50% chances of dying. There are six main types of Ebola virus, and it's spread from human to human contact with the body fluids. Um, mm, so if a patient is there and it has touched the surface and you touch the same surface, you have a high risk of getting that disease. Originally, it's thought of zoonotic origin and fruit bats, which are responsible for many diseases, also is considered responsible for it. So four major types which infect which cause disease in humans. And the first one was Zaire virus, and that was the country at that time, now Democratic Republic of Congo, which is called, where it was first identified. And then basically all the names are based on the areas from where they were first identified. The third virus is Bondigoya virus, which is rare, but that has caused this recent outbreak. So how Ebola spreads? Uh, as I said earlier, it's through direct contact. If you in touch with blood, vomit, feces, or other body fluids of infected person. Also, the burial practice. If someone has died of Ebola and you know, you touch that body, you manage that body, it's washing of that body, that can create those environments where that virus could spread to you. And if you remember in the beginning of COVID-19, many of these precautions were put in place because at that time we were aware of how Ebola, which is the very dangerous virus, spreads among humans, and we didn't have initially information about COVID-19 or SARS-CoV-2 virus. So we thought it's better to have maximum protection approach than a minimum protection approach. It spreads in healthcare settings, and if I remember correctly, in 1976, the first time when it was identified in Zaire, if you have gone to the hospital, your chances of getting disease were like 7 times higher than as compared to uh, somebody who has not gone to that hospital. So in that disease norm, we recommend people not to visit patients, not to go to the hospital where those patients are being treated, just to make sure that you are protected. We already talked with the animal contacts. Its signs and symptoms, again, there are early phase, and all viral diseases mostly have very non-specific signs and symptoms. So in the early phase, you will have fever, chills, severe headache, muscle and body pains, extreme fatigue, and loss of appetite. But in severe phase, and because it's a hemorrhagic fever, you can have severe vomiting, bloody diarrhea, internal bleeding, organ failures, and hemorrhaging. Um, the signs and symptoms does not give you an idea, but if you have an exposure of a suspected Ebola patient, or you have visited those countries where this is spread and you get those symptoms, any early symptoms, highly recommend that you go to the any biggest hospital you have and tell the doctors there that you have been to that country, you had a travel history of that country. So if we look at the numbers overall on the Ebola, until now, there are like 28,652 confirmed cases. And if you look at the number of deaths, 11,325 deaths already have happened. I'm not talking about this current outbreak, but I'm talking about overall numbers. So 17 outbreaks have happened in DRC, which is Democratic Republic of Congo, and for the main strain of Ebola, which was causing the disease, uh, we have the vaccine available. So, as I said, the first outbreak started in 1976, and there have been multiple outbreaks. But the biggest one, which came, was 2014 to 2016, and around that, 28,000 were infected, and nearly half, not completely half, like 40%, died of it. More than 11,000 people died of it. So every few years, we are getting this outbreak, and this time in 2026, we have had this outbreak spread to already two countries and with 336 suspect cases. So on 24th April, this disease was like the first known case was identified, which was a health worker, and it's developed the symptoms. And on 5th May, then WHO alerted to was informed that there is a cluster of similar illness in a certain area. And on 5th May, lab confirmed that this is Ebola outbreak, and on 16th May, WHO declares public health emergency of international concern. What is this? Because this was the headline all around the world. So actually, the World Health Organization, when feels, or it, when I say feel, it means it has the data in front of it that this is a viral disease or any outbreak which has a potential to become international issue. Then they will declare that that disease or that outbreak, that public health emergency of international concern. That allows them to come up with the emergency measures, and the countries need to start working together, because again, this disease or this outbreak or this instance has the potential of infecting not only that country or its neighboring countries, but a bigger geographic area. So until this outbreak, which started in, as I said, late April and May, we have 11 confirmed cases, but we have 336 suspected cases, and this number is 88. But if I see today's reporting, more than 100 deaths have already been reported, and most of the cases were in DRC, which is Democratic Republic of Congo, but we have already two cases in Uganda. So it's already a sort of multinational disease. So what is happening? WHO has declared it as emergency of international concern. Just to remember that WHO took longer time by in declaring COVID-19 as a public health emergency of international concern, and their delay, has caused a lot of criticism on WHO that it didn't work in time. And there are treatment centers, there are rapid response teams, because again, every few years, some sort of Ebola outbreak was happening. So here is the problem. So for the predominant strain which was causing most outbreaks around the world, we have vaccines available. We have treatment sort of supportive care available. But for this variant or this strain, we don't have any vaccine because it was so rare. It didn't affect any like a lot of people. And if a disease does not affect a lot of people, there is less incentive to develop a vaccine or it focus it or have those treatment trials. So this is the big problem, that we don't have either vaccine or treatment available, specific treatment available for this virus. So how we can protect ourselves? As I said, hand hygiene. And I want you to remember COVID-19 early days. And these were the hand hygienes, clean the surfaces and avoid the exposure. If there is a patient in someone's house with a suspected Ebola virus patient, um, don't go there. Don't go to the hospital if there are being patients. These are now for Ebola patients, they come up with specialized treatment center, which has very strict infection control practices, and that's where normally the COVID-19 patient, Ebola patients are there. And if you, as a healthcare worker, you have to interact with them, you need to have protective equipment. I have already talked about avoid contacts. Again, vaccination not good for this, not available for this strain, but for other Ebola we have. And you need to also, you know, think about your travel plans, that you don't go to those areas where there is outbreak happening, and you need to identify your, report early any symptoms. Again, so in summarizing, we have already talked those points, that this is a strain which is uncommon, so we don't have vaccines or specific treatment available. Already 100 people have died in 2 countries, and globally, world is trying to make a good response. Um, so the question which people are asking, does this Ebola outbreak has potential to start a new pandemic? So I will tell you the truth. Since 2014, I'm worried. As a public health professional, I was worried when that African outbreak started, which we already said killed 11,000 people. Because my worry was this: that if a Ebola patient comes to Pakistan and have some symptoms, admit to one of our hospitals, and the problem of infection control practices is such a huge across all developing countries, or so I'm not saying one country or another, that there is a huge chance of having our own outbreak, local outbreak, starting from that patient. So that was my big concern, and that's, I think, still our big concern. Right now, all patients belong to like 2 neighboring countries, and the way the global response is mounting, we hope that, like the previous Ebola outbreaks, it will be controlled locally, and and effectively. But each outbreak is telling us how unprepared we are. This is a lesson we need to learn from it. Viruses are not waiting in a queue, and it's not necessary that there will be one virus outbreak with a potential of pandemic at one single time. There could be multiple. There could be a chance in future there are like two, lethal viruses starting pandemics simultaneously. That's a possibility. So we need to prepare our countries, and we need to develop global cooperation for these future challenges. Until then, and also we need to remember that no country will be safe unless we are all safe. So with this, I thank you for your time.